for inviting me. I'm sorry. For inviting me just to share some information on diversity in the healthcare workforce and its impact on health equity. And Dr. Hyman, thank you for this great introduction, for setting the stage for this presentation. And I'd like you to, we can go to the next slide. I just developed some very broad objectives that I would like us to be able to leave this presentation with defining diversity. I'm sure we all, I feel like I'm speaking to the choir. I'm sure we already have a definition that we use on a regular basis, but I wanted us to have one for the purpose of this presentation. Articulate an understanding of the relationship between health disparities, health equity, social determinants of health, and diversity, and describe why creating a healthcare workforce that mirrors the population served in rural and urban communities should be a priority when addressing health disparities and inequities that plague vulnerable populations. Next slide. Let's begin with a definition by diversity and cultural humility. The diversity is respect for and appreciation of similarities and differences each person brings to society, including but not limited to national origin, language, race, color, disability, ethnicity, gender, age, religion, sexual orientation, gender identity, and socioeconomic status, veteran status, and family structures. And this is, the list can go on, and this is the definition from the Centers for Disease Control. But the idea, the key thing for me is that it's respect for and appreciation of similarities and differences, because this is what makes us stronger. Cultural humility. I always like to include this definition for cultural humility in any presentations, because we can have a workforce that mirrors the population, but this requires, if we really want to decrease health disparities, improve health equity, we all have to work under our umbrella of cultural humility, which is having a humble and respectful attitude toward people of other cultures. It involves ongoing self-exploration combined with a willingness to learn from others. It helps us recognize our own cultural biases, which we all have, and realize that we can't know everything about every culture, which is sometimes the term we use in the past, cultural competence, which implies that, hey, I'm going to become competent about a certain culture. And we can't expect to do that. That's impossible because we have differences within cultures. We learn from our patients and their families and acknowledge their cultures and how these cultures affect health without making assumptions, and that's very key. We cannot make assumptions. Through these efforts, we are able to promote accessible, affordable, culturally proficient, and high-quality care. Next slide, please. These are just some of the reports that have been done over the last 20 years, evidence-based research reports that validate the need to diversify the healthcare workforce. In 2003, the Institute of Medicine, it was named at that time, report Unequal Treatment, really set a precedent for showing through evidence-based research the inequality in healthcare received between Black African Americans and white Americans. And so they're repeating that study in 2024, and it's the current state of racial ethnic disparities in healthcare proceedings of a workshop. It's revisiting the unequal treatment report. And what they're finding is some of the same issues that were prevalent in 2003 continue to be prevalent in 2024. You can, next slide, please. So, what do these studies show? These are just some of the things a diverse racial ethnic healthcare workforce that mirrors the population the evidence has shown. It strengthens the trust between patients and healthcare providers, which can lead to increased patient compliance with their plan of care. It fosters cultural humility, as we discussed earlier, among providers and removes sociocultural barriers. It helps to increase access to quality healthcare services, address preventable health conditions, and tackle social determinants of health. And it also improves healthcare outcomes and decreases mortality rates among marginalized and racial and ethnic minorities. And it also addresses that language barrier that was just discussed in the previous, in our case study this morning. Next slide, please. I also like to address, when I'm talking about diversity, issues related to definitions related to bias, implicit bias, and racism. Biases, we all have inherently human natural products of our environment. We all have some type of biases. We develop these biases and perspectives as reactions to our life experiences that prepare us to evaluate information we will encounter in our future. Biases remain relatively unharmful until our assumptions, our biases begin to have impact on our behaviors toward other people. It's so important for us to acknowledge our biases so we can find ways to mitigate their impact on our decision making. Now, implicit or unconscious bias can become dangerous because it operates outside of the person's awareness and can directly contradict a person's espoused beliefs and values. A person will deny, I have no biases. No, I don't have biases against that culture or that race or that gender, but yet their behavior exhibits other. This exhibits things like, hey, you individuals may find what you said or the way that you reacted as offensive. And so what is so dangerous about this is automatically seeps into a person's affect or behavior and is outside of the full awareness of that person. And lastly, racism, which is assaults on the human spirit from the forms of actions, biases, prejudices, and an ideology of superiority based on race that persistently causes moral suffering and physical harm to individuals and perpetuates systemic injustices and inequities. And usually when we mention racism, it makes you feel a little uncomfortable. But the reality is that racism exists, that healthcare professionals are a microcosm of the larger society. And as a result, we bring the very good, the not so good, and the ugly within our profession. So I would say that majority of our healthcare professionals are not racist, but when we see racist behaviors, we must acknowledge them. We cannot ignore them. Next slide. An example of how implicit bias contributes to the healthcare disparities. Mrs. Smith, a 60-year-old Black woman, presented to my office visibly upset about a recent appointment with a subspecialist. She had been treated poorly, she said, from the moment she arrived at that physician's office. Most telling, the patient said, was that the subspecialist assumed that her heart disease was related to a diet that included a lot of fried chicken and other Southern dishes. In reality, Mrs. Smith has been a vegetarian for more than a decade, and her condition is more likely related to her family history. Again, that keyword assumptions and biases, you can see all of that, and that's a true story. And you can also see how that can lead to mistrust of our healthcare providers. So again, we can't make assumptions. We have to get to know individuals, and it simply could be asking a question. Can you tell me about your diet? Can you tell me about your exercise? Next slide, please. I put this slide here because these are separate, addressing the healthcare workforce shortage, which is critical right now, and increasing the diversity of the healthcare workforce, which I believe is critical right now as well. These are separate yet intersecting issues that must be addressed to successfully eliminate health disparities in Louisiana, which means that all the funding that has been received to increase, most of my interest has been, my research has been focused on the nursing workforce, but it's all of the healthcare workforce has been increasing numbers. But we must keep our lens open to also addressing how are we increasing the diversity of our healthcare workforce as we increase the numbers. Next slide, please. Okay, we all know that the U.S. population is growing considerably and has become more racially and ethnic diverse than ever. The population of people who are two or more races is projected to be the fastest growing racial and ethnic group, followed by Asians, Hispanics, and Black African Americans, respectively. Next slide. I like to include this slide in my presentations because many times when we read statistics and we read reports, research reports, they may be based on national data, but Louisiana is unique. It's similar. It's not, our statistics, our demographics are not the same as the nation. And I just like to share that. And this was for 2022 U.S. Census Quick Facts. 62.4% of Louisiana's population is white compared to 75.8% of the U.S. population. And then we look at the Black population, 13.6% of the U.S. population is Black African American compared to 33%, approximately a third of Louisiana's population. For Asians, 6.1% of the US population, 1.9% of the Asian population. So the whole idea is that when I go to conferences and I hear about these great studies, my first thought was, okay, we can replicate that in Louisiana, because the findings that were obtained for a national study may be a little different for us here in Louisiana. Next slide, please. And this is showing ethnicity in terms of our Hispanic Latino population. According to the US, 18.9% Hispanic Latino. In Louisiana, according to our census, is 5.6%. So that's a significant difference in terms of the proportion percentage of our population that is Hispanic Latino. Next slide, please. So this is where we get to look at, health disparities, health equity, social determinants of health, diversity in the healthcare workforce are all integrated. Health disparities, and you all know this, I feel like I'm speaking to the choir. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged, that are closely linked with economic, social, or environmental disadvantage. I like to include education there as well. Then we look at health equity, the attainment of the highest level of health for all people. This is our goal. This should be our goal. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequities, historical and contemporary injustices, and the elimination of health and healthcare disparities. Now, social determinants of health are the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. See how closely they're related to our health disparities, economic, social, environmental. And then we come to the diversity of our healthcare workforce. How is that integrated in this picture? Well, increasing the racial ethnic diversity of Louisiana's healthcare workforce is critical to dismantling health disparities and inequities that plague our communities of color. It offers a beacon of hope for a healthier, more equitable future. So I hope that you can see how these 4 elements will help to improve, dismantle health disparities and improve health equity. Next slide, please. And this is a schematic, and I think I've seen one in one of the ECHO series, very similar, but it just highlights the difference between equality and equity. Equality means each individual or group of people is given the same resources, opportunities. As you can see, I think the diagram may be on your left. Equity recognizes that each person has different circumstances and allocates the exact resources and opportunities needed to reach an equal outcome. So in the diagram on the right, on my right, you can see the person that person just needed a little higher ladder to achieve the same outcomes as the person on the left. Next slide, please. So health disparities. I don't need to go through all of these for you. You all know the health disparities that exist in our rural communities and in our urban communities. Compared to those living in urban areas, rural residents have higher rates of mortality from heart disease, respiratory disease, cancer, stroke, and unintentional injury, which are the 5 leading causes of death in the US. We all know the COVID-19 pandemic amplified the long-standing health disparities and inequities that disproportionately affect racial and ethnic minorities in Louisiana. And we knew this way before the pandemic ever came to be. We know about the maternal Black African-American maternal mortality rate and how critical it is that we must address the issues that are leading to that critical loss of life among Black African-American women. And also the infant mortality rate. 10.5 infants per 1,000 live births is more than twice the rate of white Louisianians. And then we have Black African-American people in Louisiana have a higher death rate than white Louisianians for almost all causes of death, and with the exception of suicide. Next slide, please. So let's look at Louisiana's healthcare workforce. Next slide. What I've shared with you, I found a study that was conducted, the race and ethnicity of the Louisiana healthcare workforce, report 2023, that was conducted by Fitzhugh Mullen Institute for Health Equity at the George Washington University. The data that I really have been focusing on the last 12, 13 years has looking at the diversity of Louisiana's nursing workforce. But this gave me information about other healthcare professions within our state. And I apologize for the size of the diagram, but I will make sure I will send the link to the actual study so that you will have that. And it's also on my reference sheet too. But you can see here the red bar that's vertical on the, let's look at the left side, which is representation of Black health professionals in Louisiana. Everyone sees that? And there's a red vertical line that represents the percent of the Louisiana's workforce that's Black African American, which is considered the benchmark, which is approximately 30.2%. What this diagram is showing is that Black workers are underrepresented in all diagnosing and treating professions. And these are considered the diagnosing treating professions that require advanced education. It includes our RNs, rehab therapists, APRNs and PAs, pharmacists, and also physicians. And then you have Black workers make up 30.2% of the labor workforce, but only 6.1% of physicians are Black in Louisiana. And then Black workers are best represented in healthcare support and tech positions, which typically do not require advanced degrees. And there is a report presented to the Health Works Commission, I think it was in 2022, that said that data revealed that the majority of registered nurses, physicians, and surgeons are white. Most home health aides are Black, and licensed practical and licensed vocational nurses are roughly evenly split among white and Black workers. Data also shows that Black workers, but rarely reflect the actual racial distribution of the Louisiana population. In fact, the data show that white workers are largely concentrated in occupations with high earnings, while Black workers are concentrated in occupations with relatively low earnings. And that's an historical perspective, but we're seeing it translated even in this data comes from 2020. Whereas on the right-hand side, you can see the mark for approximately 60.2% of the workforce that's white in Louisiana. You can see how for those diagnosing and treatment that professions that they far exceed the percentage of that workforce. So again, those disparities exist within our workforce. Next slide, please. So education is key. Education, educating a racially and ethnically diverse healthcare workforce will produce a racially and ethnically diverse healthcare workforce. So we must educate people of color, a diverse, in order to have a diverse workforce in our state. Next slide, please. Again, these slides will be available to you, but what these slides show is we have between 2018 and 2020, there are 26 registered nursing programs in the state of Louisiana. And what this slide shows the percentage of Black graduates from those nursing programs. And the DI is a diversity index that was computed using the percentage of the healthcare workforce that's Black and the percentage of the graduates that are Black. And they came up with this diversity index. The green represents that they exceed the percentage of the Black workforce in Louisiana. And the green areas represent the 4 HBCUs, historically Black colleges and universities in our state. But you can see the numbers, and then Delgado has a 0.81% diversity index at light pink. But as you go down, you can see it gets dark and darker, which means there's a smaller and smaller percentage of Black graduates that were produced by these colleges. And my alma mater, which is Southeastern Louisiana University, where I received my BSN, has the lowest percentage of Black African American RNs graduating from its program. Then we can look at, and I know that I'm limited for time, and on the other side is Hispanic, but for the purpose of this presentation, because of limited time, I'm focusing on the largest minority population in our state, which are Black African Americans. Then we look at our medical programs, and you can see what you see is the dark color, which means that there's a very low percentage of physicians produced by our medical schools here in Louisiana. So we have data to support that there's work that needs to be done in our state. Next slide, please. And this, I'm not going to go into this, but it looks at physical therapy and looks at APRNs. And you can see APRNs, you have Southern University and Northwestern that are producing the most Black African American APRNs in our state. And then you can see how the color changes thereafter. In terms of physical therapy, again, very small percentage of Black African American graduates. So, based on the information I've shared, we have a call to action, which is to track recruitment and retention through monitoring and evaluation of recruitment programs to identify and address issues in recruiting and retaining racially and ethnically diverse healthcare workforce. Expand workforce pipelines that are working. We've tried so many things, but there are some out there that are truly working, that more racial ethnic providers are recruited to work in underserved communities and the communities they grew up in. Grow your own is one of those ideas. Expand partnerships with institutions of higher education in Louisiana, including high schools and community colleges. And that work is being done. That is being done. What we need to do, though, we have to be accountable in order to really look at the outcomes of that work. Identify, develop, and evaluate strategies to reduce financial barriers in education and training processes in health professions, like redundant repetitive fees, and also implementing holistic admissions practices. Identifying promising infrastructures that support academically and professionally racial ethnic students pursuing careers in health professions, and recruit, hire, and retain nurse faculty in higher education. Next slide, please. So, increasing the diversity of the healthcare workforce to decrease health disparities and inequities must be intentional. I've been at many tables at many meetings and much discussion on increasing the number. The discussion needs to be there about also increasing the diversity of our workforce in order to address the disparities that exist within our state. Reducing the substantial health disparities and health inequities experienced by rural communities will require adaptable, dynamic, racially and ethnically diverse teams of providers. These teams must be designed and deployed around the specific health and social care needs of local communities. And achieving a diverse healthcare workforce that can meet rural healthcare needs will require a substantial commitment to identifying the unique healthcare and workforce needs of rural communities, adequate investment in the workforce and infrastructure, and stable and sustainable financing mechanisms. Next slide, please. These are my references. Next slide. Next. Quite a few references, and my contact information. I apologize if I went rapidly, but I wanted to make sure I got everything in on time. To be honest with you all, I actually had to cut my presentation down twice. So, so I'm passionate about this topic. So now we're open for any questions.
So I just want to say thank you, Dr. Bienemy. That was a great presentation. And I too had to trim my presentation